We're live. Hi, Corrina.
Hey, how's it going?
I'm good. How are you?
Oh, good. Other than
Well,
the ankle twisting earlier, but it's all good.
well, I'm glad that it wasn't bad enough that you weren't able to join me because having the one ankle I've sprained 7 times in my lifetime, and even just thinking of it like makes
Oh,
me like tense up everywhere. So
I know. Just seeing videos, it like freaks me out.
no.
I can't do it. Or
Yeah,
like,
neither can I. I can't watch those shows. Like
no. Or
they're
Braden
really
will
popular.
show me a video of like a football injury, like and their leg like goes like this, and I'm like, oh my God, turn it off. I can't watch that.
It makes
You
me
think
want to
it would
throw
help
up.
me.
I don't understand the people who get joy out of watching videos like
I don't know.
that.
Oh, anyways.
Well, so anyway, welcome to Losing Your Damn Mind with Andrea.
Thank you. Thanks for having me.
So we are exploring how everybody is reacting in their different ways to a COVID-19 world. And as a little bit of background, Corrina is actually the sister of one of my classmates from when I was in photography school back in 2009 and 2000 to 2011. And so your sister Cherie moved back home after, and you moved to Regina shortly after we finished. So
Yeah.
I remember Cherie sending me a note and being like, "My sister needs some friends. Would you hang out with her?" I was
Poor
like,
lonely
"Okay."
Karina. Well, I was grateful to meet you.
Yeah, as was I, because like your sister, you're pretty cool. So
Oh, you're cool too, Andrea.
yeah, our 0 viewers would probably agree.
That's okay, we'll get viewers later.
That's right. So, other than any hipsters who were like, "Well, I thought they were cool before everybody else did." So anyway, so for the viewers, you work as a nurse in the health region, and so which is something we've sort of been able to bond over, even though I'm definitely not a nurse, but we are both technically healthcare practitioners.
That's right, we work for the same business or company, hey?
That's right. And more recently, one of the things we've been doing is working in the test centers for COVID-19.
Yes, yeah, so I needed some extra work. Um, so actually there was an email that went out and basically you just had to send an email to HR and hope that you could work for Healthline. So I tried that, but I guess they already had their needs met, which is what they told me, and I was like, no, I need work because I got laid off from my other job. Um, so they said, we do have some room at the COVID test site if you would like to work there. And I was like, sure, I don't really care. Let's do it. I have no idea what I'm supposed to do, but sure, let's go for it.
My
Um,
assumption is you take the Q-tip and you jam it up people's nose
yeah, pretty much.
and tickle their eyeballs from what I hear.
So there's the swabbers and then there's the screeners. And then there's like other little jobs like we have kind of like porters. I don't think we call them that. Anyways, they'll bring the patient into the facility for us to test them, and they just basically walk them out um, to keep a good flow because we don't want
Yeah.
people passing each other in the hallways, stuff like that. So my first day, I was orientated to be a swabber,
Mhm.
and it was interesting. So basically, we have a shortage of nasopharyngeal swabs, which are the big long swabs that go through your nose to the back of your throat, and then we tickle the back of your throat.
Oh,
And everybody's all freaked out about it.
yeah.
I can't say I would want to have that done either.
No.
Um, so anyways, in replacement of the NP swabs, we're doing throat and nair swabs. So basically you take the first swab and you tickle the back of the throat. You're trying to get like kind of back to the tonsil area.
Mhm.
And you have to try and avoid touching the tongue because if you touch the tongue, then you contaminate the swab and it's useless.
Right.
That is really hard.
Yeah. Well, people, I mean, I don't know about the average person, but I can imagine if people out there who react like I do when it comes to having to get like a throat swab done. Like I've had doctors laugh at me for for
That's hilarious.
like my self protection instincts just kick in. Is like, no, get the fuck away from me.
Somebody said that I don't know where they were doing it, but they were getting patients to do their own throat swabs, which I think would be a lot better in a way.
I'd
You know,
probably
'cause
be
then you
like,
can
I'm just
control
gonna
it yourself.
put it back there and be like, yeah, I totally did it. Here you go.
Yeah, we haven't been doing that, but, there
It's probably good.
yeah, so I've been using the tongue depressor to try and keep the tongue out of the way. I know, they kinda said to go easy on the tongue depressors because we might run out of those too.
Oh,
But
fantastic.
I just feel like, do I wanna waste another swab and contaminate the swab by touching the tongue, or am I just gonna go ahead and go with the tongue depressor? So, I do, but even then, some people have a hard time getting their tongue out of the way. It's like when they open their mouth, their tongue lifts up, and it's like, can you, like, put your tongue down?" Like, you can't even tell them
Go
to
on.
yeah, "Ah" will sometimes kind of work. Or some people just can't open their mouth. Like, this is as wide as they can go. I'm like,
Huh.
"Oh, okay, this ain't gonna work."
Well, I guess it's the same thing, or well, not the same thing, but similar to doing fundus pictures in the eye center, because there's like the technology that we have, like in the time that I've been there over the last 3 years, the camera technology has gotten so much better because the old camera, you had to have the pupils dilated, and
Mm.
even with some people, if they've had trauma to their eye, their pupils only go open so far. So if they've got like a pinpoint pupil, you're not getting any information out of the eye. But now the new cameras that we have do like 180-degree view of your eye, and you don't have to have your pupils dilated at all. Like as long as you can get the patient positioned properly, you see everything. And
Nice.
it's good because it means that we can get patients through a lot faster, and plus they're able to drive themselves home after because
Yeah.
they haven't been dilated. But yeah, I would think that yeah, just every once in a while you'll get a patient that their physiology does not,
It just doesn't work.
it doesn't help.
Yeah.
So
Do
yeah,
you
I
use
guess.
an eye speculum for that, or do they just open their eye?
Funny enough, no, we don't. We just get them to open their eye, and then sometimes we'll have to like get in there and pull their eyelid up or down,
Oh, okay.
depending. Yeah, if they have really narrow eyes, sometimes it's a bit of a problem. But the one when the camera that we have now was sort of new, one of the ophthalmologists wanted to try it out, and we didn't realize at first that like seeing your eyelashes is just sort of, it just happens. Like it's rare that you'll get a patient that you can't see the eyelashes at all. And so the
Oh.
doctor who was trying it was like, no, 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 I feel like this could be better. And he went and he got a speculum and put it in his own eye just so he could see better.
Oh, that's hilarious. I can't imagine putting a speculum in my own eye, actually, it looks so gross.
Well, and anybody who's seen A Clockwork Orange probably is like, no, only bad things happen.
I've never seen that, I need to see it.
I mean, it's definitely got a following. Some people love the shit out of that movie.
How old is that movie?
Oh,
'80s?
no, I think it was even the '70s.
Oh,
Here,
really?
if only there was a way we could find out. We have all the knowledge of the world at our
Right.
fingertips here. 1971. Oh,
Oh,
so
wow.
early '70s too. So,
Okay.
yeah, we've gotten off track here.
Oh, yeah, sorry.
That's all right. Hopefully, it'll be entertaining for 0
Yeah.
years.
Um,
Yeah.
anyways, the swab, so basically, if I can't get them to open their mouth wide enough, I'm just gonna use a nasopharyngeal swab on them. We're saving the NP swabs for children
Mhm.
because most children can't really sit still enough to have all 3 areas swabbed, throat and
Yeah.
both nostrils. Yeah, so, well, they don't like the NP swabs much either, but
Do you, for the NP swabs, do you have to do both nostrils or just one?
just the one, and then you're done. Oh, I can't imagine trying to do 2 NP swabs on a child. They would never let you get near them again.
Yeah. Well, so in the episode I shot last night with Erin, she was talking about how she had to take her daughter, who's 9, to go get a test done, and yeah, I guess it did not go well.
They did the NP swab on her.
Yeah, I mean,
Yeah,
I do feel really bad for her because again, I would probably behave just as poorly if it were
I
me.
feel like these traumas stick with you, like, even if you're a young child, it sticks in your mind. Like, my sister had multiple problems with her ears and nose, and she remembers every nasty test they ever did to her, so
Oh,
I
yeah.
these kids, like, it sucks. It's a crappy time.
Yep. Yeah, I'll blame some doctor in my past for my issues with swabs.
Yeah, exactly.
Um, so aside from, like, just how your duties have sort of changed and moved around, like, how have you been dealing with the world of COVID-19? Like, I know we talked a while ago, and you did indicate that you'd been under some stress because of it.
Yeah, so I work at a private center, and I'm an operating room nurse. And unfortunately, all we do is elective surgeries there. So we kind of had this impending doom that, yeah, we're going to get laid off um, because elective surgeries were canceled. So I would say my stress was a 10 out of 10.
Yeah.
Like, probably one of the most stressful times in my life because I knew I was losing my job. I was trying to get casual work. Like, I got some COVID test site work, but maybe only one day on the weekend. And they won't let
Oh.
you work 4 weekends in a row. So I worked my 3 weekends and then it dried up and they didn't really have any work for me during the week either. So I worked my last shift and I bawled and
Mhm.
applied for EI. Like, it just doesn't make sense that a nurse is applying for EI during a pandemic,
Yeah.
right? Uh,
Yeah, no
The pro
kidding.
well, and, like, the problem is I'm so specialized, I can't just go and work in Emerge. I wouldn't even know what to do. Like,
Didn't
um,
you work in Emerge back in the day, though? Oh, I thought
no,
you had.
no, I you know what? I just I can't do it. Those nurses are amazing, I could never work in emergency. I don't know how they
Oh, I don't
like
either. Like, last year when my dad was in the hospital in March, then my mom was in the hospital in August, and then my dad was in the hospital to the end, in November. The in When one of them was in the hospital early, I guess maybe it was when dad was in March, there was a crazy woman in the ER who was screaming. There was like, I think 2 cops and maybe 4 security guards, like, all sort of blocking her into this room, and she was screaming at the top of her lungs about how she was gonna sue the shit out of everybody, and they were holding her against her will, and I think there was something about, like, a custody thing. I'm not sure, but she was like a small woman, and I was like, why are there 6 like burly dudes handling this?
Oh my god.
And she was being loud, but I guess at least she was contained to the room. But that said, when you're there, like, for a separate reason with a loved one, it doesn't help your stress levels go down. Then when mom was in the hospital in August, there was a dude in the room next to her who was locked in the room. Like, I didn't get a good look at him through the tiny window, but he did kind of look like a white supremacist, um, possibly. And he was screaming about how his mom owed him $40,000. And then, like, because I sort of walked past and you could kind of hear what he was saying. And I went into my mom's room, and then I could still hear him, like,
Yeah.
next door. And then all of a sudden, there was this huge bang, and all of the people in the bullpen, like, jumped and looked in his direction. And I think he had, like, smashed his head against the glass and he cracked it.
Oh my
Uh,
god.
yeah. And then apparently I think he peed on the wall after.
Sorry, that's just funny.
Yeah, so, I was like, "How on earth do people work in this? Like, how would you get anything done without, like, feeling like, 'Oh, by the way, literally everything that we have here is potentially a knife.'"
Yeah, right? Yeah,
Yeah,
I couldn't, like, that and it's the unexpected. They never know what's coming in.
yeah,
The OR, we know. Like, we know exactly what's coming in. It's
yeah,
booked. Like, I
yeah,
mean, I guess unless you're working in a trauma, but still, you're gonna get a report ahead of time, and you're gonna be prepared, hopefully, for that patient to come in, but
yeah.
good
Well,
for those
even I
ER
mean,
nurses.
yeah, like, even, because I suppose it's probably not uncommon that they get patients coming in that might be presenting with one thing, but you don't know their medical history or their,
Mhm.
mental, health history either.
Yeah.
So, yeah, that would be kinda
Mhm.
terrifying.
Or infectious, like, infectious history too, like, maybe they have, I don't know, group A strep, invasive group A strep, which I if I remember correctly from infection control, they have to, like, contact trace for something like that, just
Mhm.
exposures to staff and such, and then public health, I think, follows up, or OH&S maybe. Yeah, so, like, you just never know.
Yeah, yeah. So, would you say like, I guess there's a lot of tests being like, I saw a report on the newspaper the other day saying that we'd done over 27,000 tests or something like that, so
Okay.
I guess those numbers are good. I don't know. But all I do know is that I'm so glad that I'm not on the front line, but that
Yeah.
there are people like yourself who are brave enough, who are like, "Yeah, give it to me." I'll or at least I'll suit up and I'll help.
Yeah. Well, that's the thing. We have PPE right now. I mean, it's starting to get a little bit low. I know they just started telling us to implement continuous mask use, which really sucks. Um,
Mhm,
Basically, they're just hoping that you can wear that mask for as long as possible and as many like patient exposures as possible until it either gets soiled or you have to go on your break and then you take it off. So that kinda sucks, but I still even when I'm at the test site, I feel like I'm protected. I'm wearing full PPE, so gown, gloves, mask, I have goggles, and then I have a face shield, so it literally, like, comes all the way down here. Because when you're
right.
doing a throat swab, they're gonna cough in your face,
Yeah,
which
for sure.
is not, you know, we don't
Pleasant.
really want that, but that's the only way we can do it.
Yeah.
That's why I think NP swabs are a lot nicer in that way, like, they're not really gonna cough. However, I did hear, from one of the medical microbiologists, that the proper way to get an NP swab done, the patient should sneeze. So, I don't know.
While
I
it's up their
haven't
nose?
Yeah, well, I don't know if it's after because, like, you're tickling the back. None of my patients have sneezed, so I hope that I've been getting a good enough viral load.
Maybe
Um,
you should be putting pepper on those bad boys.
yeah.
Oh, that
Oh,
would just burn.
oh my god, that would burn.
That would
I
be
gotta tell you about this little, baby that I did a swab on. It was I thought, "Oh, this is gonna be awful." He was in his little car seat, and he was sleeping, like, I think he might have been a year, maybe less.
Mhm,
And so, obviously, we're gonna do an NP swab on that kid. So I thought, I'm just gonna leave him in the car seat and see if I can just do it like this because
mhm.
he's sleeping right now.
Yeah.
So in I went, quick little twirl, brought it out. He like kind of went, "Ah," and then went back to sleep. And I was like, this is the best swab I've ever done.
Oh.
It was so cute.
Yeah, if only we couldn't all be sort
I
of asleep.
know. Yeah, I wish. The
Yeah,
anxiety levels in people coming in, like, I guess it's all different. Everybody's different, but there are some people that are really sick and need a swab, but will refuse to come into the facility,
yeah.
which is hard, like, 'cause we we're changing PPE in between patients, well, without, like, the mask, but we have our face shield, we're always wiping it in between patients,
Mhm,
and we're always wiping, like, the area that the patients are in.
mhm,
Every patient is wearing a mask when they come in, so they're not, like, coughing all over the place,
mhm.
and it's actually done pretty well, I think. So I I hope that that can help ease people's anxiety a little bit to come and get tested.
Yeah.
But like, I guess if you don't want to come and get tested, just make sure that you're staying home until you're well again.
Yeah.
And yeah, I think that unless things have changed, I think that you have to be asymptomatic for 48 hours before you can come off self-isolation. But things have changed like every day. It's so hard
Mhm.
to keep up with the guidelines.
Yeah. Well, so one of the things I wanted to ask you about, since we've been talking about PPE, so people have been suggesting that people who are able to do 3D printing help out creating masks or shields anyway,
Oh,
and the holders for the ear savers, basically.
yeah. Yeah.
And have they talked about that? Like, or I've also heard that because medically they need to be tested to make sure that it's like the right kind of materials, I guess, so that stuff
Oh.
can't sort of, I don't know, because this is definitely not my field of expertise, but I'm curious as to whether there's been talk about if there was
Well,
a supply of that, if it would help.
I'm wondering I'm wondering about the testing. I don't know about that, but we did get some shields in yesterday, an infection control that they wanted us to distribute to like ER, ICU, the anesthetists, and the OR.
Mhm.
Oh, I mean, it was a good try. It wasn't good. Like, I put it on my head. It was shaped like a triangle, kind of. It kinda looked like this, so you had to put it on like this, and then it would fling off your head. And it just would not stay, it would slide down, um, and if you were trying to do patient care with something like that on, you would, like you'd have to reach up and adjust it all the time, which you're trying to avoid touching your face
Yeah,
with contaminated gloves or hands. So, I mean, it was nice. It was
yeah.
a nice thought, but it just the design's not good, and we took it to ER.
Good
The reactions. It was literally, "WTF, what is that?"
luck.
They tried them on, ICU tried them on, it didn't work, like,
And do you know where they came from? Like, were they
I
just
actually have
3D
no idea.
printed by somebody
I
or
don't know if they were 3D printed or if this was some kind of a company that tried to make I don't know. It was the flimsiest thing I've ever seen. There's no way you could wipe this thing in between. It was like my friend said, it's like wiping cellophane down.
oh.
It was so thin.
Oh.
Like, our good face shields are the ones with the elastic, it's the ones that
Mhm.
we use at the test center. You can wipe it, like, a million times, we just, like, write our names on it and keep it.
Yeah.
And you just keep it until the elastic is done in it. And so far,
Yeah.
they've been lasting quite a while. The other thing is N95 masks. Everybody like, we're in such shortage of those that they are locking them up in the hospitals, I guess.
Yeah,
Mm.
I even before I finished work, like, I remember, we had a little get together, just with our immediate staff, and we're like, "Okay, so we've heard that there are things going missing, in the hospital," and, like, I guess probably PPE was the main concern, but,
Yeah.
it was also they were like, "Okay, so we're just gonna everybody make sure you keep your key on you, and we're just gonna keep the office door locked the whole
Yeah.
time, even though we're here and we're working." So, but
Oh, that's a good plan.
well, yeah, and I guess just in general, like, when people get scared, like, they will try
Hoard.
things that they wouldn't necessarily try other times, so
That's true. That's true.
yeah.
Mass panic. We all saw that.
Mask panic, yeah.
Mass panic, mass panic, teen panic.
Yeah, a whole lot of panic in the world right now, so
Yeah, it's too bad.
well, so since I see that we're getting up to the 24-minute mark, and I try to end on a positive note. So, do you have any go-tos that make you happy, or when you just need a laugh or a smile, just for a second, something that can make the world seem a little less bleak?
Well, number 1 is my dog. Like, if you have a pet, I don't know, it's just that you just get that unconditional love. I don't
Mhm.
know. You look at your pet and it's just like, "Oh, I just love you so much, and you just bring so much joy to my life." like getting a dog was definitely one of the best things we ever did.
Yeah.
She just turned 3 in April.
Oh my god.
Yeah, they
She's a
get
little
so I
puppy.
can't believe you're so big already.
She's a little tank, that one.
She's a tank. She's a French
Both in
bulldog.
size and in personality.
I wonder if I can, like, aim my camera at her. She's like, "Ugh, don't mind my mess," but there she is.
Oh, I could just see her ears. "Hi, Evie." Aw.
She's always gotta be, like, right next to her humans.
Yeah, Buster's kinda like that too, like, even if I'm just going upstairs to use the washroom or something, he'll be like, "Hey, what you doing?" And sometimes I'll hear him sorta come up the stairs after me, and he'll just sorta sit outside the door waiting for me. It's like, "Dude, you're not missing anything."
Right? I know, they always have to be in on it, like, they can't miss out.
Yeah.
So, yeah, definitely my dog. Like, spending time with my husband too and actually doing things together, so we've been going on more walks with the dog. That just
Mhm.
makes me feel so good inside, and exercise really helps with anxiety too.
Mhm.
Um, so that's a good one, and then we play a lot of video games, as you can tell.
I was gonna say, looking like a DJ or
So, if I need to get my mind off of the world for a while, we'll just play some video games, and it's nice because we connect with our friends and our family, and we can talk to them, like, while we're playing together and
Oh,
working as a
that's
team,
good.
so that's nice. Like, it just sucks because I just wanna see my family so bad.
Yeah.
Yeah, like, a lot of my stress too was the fact that I knew I couldn't go see my family, so I
Yeah.
probably cried every single day in March.
Aw.
But, like, having all these resources and having the technology too really helps. Like, can you imagine if you were going through this in a time where we couldn't connect like this?
No. Well, I
Like,
mean, probably we would have been talking on our landlines a lot.
yeah, yeah.
But yeah, like, a few of, the guests on the vlog, we've talked about how it's good that technology exists so that we're able to do things like this, where we're able to talk to each other, although it's not the same as, like, being like, "Hey, bring Evie over and we'll go
I
for a walk
know.
with them and Buster." So,
Yeah, definitely not.
yeah, and just being able to, like, reach out and, like, give somebody a hug, and or,
Yeah.
like, shake a person's hand, because we ended up selling, my dad's car, and, it's somebody I used to work with, and his son it's his first vehicle, and, when they came over, I reached out to hand him the keys, and he was like, "Oh, here." He, like, went in for a shake, and I was like, "Nah, COVID-19."
Yeah. That's the same because like, my husband works at a dealership.
Mhm.
They're all about handshakes, right? And times are changing.
Yeah.
Maybe they can do an elbow bump. No, foot tap, foot tap. Oh, I
Yeah,
don't know.
yeah, it does make you wonder how things like, the things that are gonna change and how they're gonna stay different
Yeah.
once we're out of this, so
I think that, there will be some good changes come out of it. Um, I've never seen anybody care so much about washing their hands as people do now. Like,
yeah.
when I worked in infection control 2 years ago, we were harping on people to wash their hands. It was
Yeah.
like pulling teeth. "Well, we don't have time." Everybody's got time now. They're making time for it. So, I don't know, I just hope that that continues.
Yeah, no, so do I. Like we at in medical media, we try to be very diligent about making sure that our hand hygiene is good. And my hands always get really, really bad in particularly in January and February when it's been a few weeks of just dryness on top of the washing. But
Yeah.
man, like my hands were just a wreck in the first part of March
Yep.
when things were starting to get bad and they were being like, okay, everybody be more conscientious about it. I was like, I'm not going to have hands. I'm just going to have bloody
I
stubs by
know.
the time this is done.
It's so hard, but I found some good lotion at Costco if anybody wants to brave Costco.
Yeah.
It's O'Keefe's. You can find it
Oh,
anywhere. But yeah,
yeah.
O'Keefe's seems to really work for me,
I've seen that because it's the like it's supposed to be the
like
lotion
working
for like
hands.
men who work with their hands all day.
Yeah.
For I've been finding that there's a lotion from Lush just called Charity Pot, and
Oh.
like they use the funds for it to help different charities, and it's the only stuff that I find works. It smells like
Oh.
Zinc-O-Pax, but it's like I'm like, okay, well, if it smells like diaper cream, like it probably should work. And yeah, like it sort of when my hands get really bad, it burns when I put it on, but then the next
Mm,
day my hands actually look and feel better. So
nice. Oh, I've never heard of that stuff. I'll have to try
yeah,
that.
it's yeah, I love the stuff. So someday when we're not dealing with this, I'll I'll let you try some.
Sounds good.
Yeah, that would probably be like one of the worst things to do right now. Is like, oh, here,
Yeah.
try this lotion that I've had my
Yeah, exactly.
hand.
Oh my God.
Okay, well, I think what we'll do, oh, and I'm here, I'm like meaning to put up all these resources again, and I forgot. So, and I know that I did that in the episode, I think, with Erin yesterday. But
Oh.
so, right now, there's still a variety of reasons that anybody might need help, whether it's with mental health or if you're, say, low income and needing resources for food or shelter or whatnot. And the 211 website has a variety of places that people can look for if they need some help. And yeah,
Nice. Oh, that's awesome. I didn't even know about that.
neither did I. I think it just sort of cropped up on Facebook recently, and I was like, oh, this is a really good resource for people.
That is awesome.
Yeah. So
There's the
anyway.
Saskatchewan.ca website as well for anything like updated on COVID, if anybody is interested in that.
Ooh, that's good to
Yeah,
know. Should have
like
created a banner.
that's okay, they can find it. Saskatchewan.ca.
Well, we have the technology if I can spell properly.
It's the government's website, so it's got a whole bunch of stuff on there.
There we go,
Awesome.
Saskatchewan.ca. Yeah, because hopefully, yeah, we hope that our government wants us to be updated and in the
Mhm.
know for things that are going on for this continuingly evolving situation for everybody.
Yeah.
So yeah,
I think there's also a survey on the site. If you're feeling ill, you can take the survey and then it'll direct you as to what you should do next, like if you should be self-isolating or whatever. I'm pretty sure there's a survey on there.
yeah,
But
I
if
think
you're
you're right.
ill at all, just call 811.
Yeah,
Yeah.
and
Like,
they give a callback number for that generally, right?
depending how busy they are, yeah.
I
Like I
think
think
they've
they've
been
been
pretty
pretty
busy lately.
busy. Yeah. But
Yeah,
seriously, if you're worried, just call and they'll refer you to the COVID test site and we'll decide if you have been symptomatic for long enough to get tested,
yeah,
or you can
yeah.
just stay home.
Well, because especially this time of year, since there's, like, so many seasonal allergies, it's really
Oh
difficult, like, if you're just like, "Oh my god, my nose is running," or "I have a bit of a sore throat," it's like, "Oh, no."
my God.
This
I
is it.
know, and it is so hard. Oh, yeah, you can't know. Well, it's
Yeah,
tough.
yeah, well, which is why
Take
it's
your
good.
reactant and see if it helps.
But this is why it's good to have, like, actual trained health professionals to talk you through it to see whether it
Mhm.
bears further testing or just maybe just stay home, so,
Yeah.
yeah.
And they opened up the testing criteria a couple weeks ago. Like, you used to have a couple symptoms before you could get swabbed. Now I think even if you have one symptom, you just have to have it for 48 hours at least before you can get swabbed.
Right.
Yeah, like basically if you're swabbing someone who doesn't have symptoms, it's going to be a false negative. So,
Oh,
yeah. That's the tough part because there can be asymptomatic carriers and we could test them and it's only a 30% chance that we would get like a positive test back. So
oh,
it's hard.
yeah.
Yeah.
That's that's one of the scariest things about this when you hear about, like, the number of people who are probably infected with it, but just
They
maybe
don't
not that
know.
they're immune to it, but,
They're just carrying it. Yeah.
actually, I'm just gonna throw something in terms of things that make me happy. One thing that makes me really, really happy is the show Drunk History.
Oh my God, that show's hilarious.
And one of my friends actually posted just the segments they did. I think it was 2 seasons ago, maybe about Typhoid Mary, which
Did
which
I see that one? I feel like I might have saw that
I
one.
may have shared it when she did, maybe, but, it's hilarious, but also, like, timely, and, the fact that
Yeah.
she had, like, had the typhoid, virus, like, for several years, but she never got it herself, but she
Spreading it.
killed a bunch of people.
Yeah. Way to go, Mary.
Yeah, so, again, word to the wise, wash your damn hands,
Physical distancing.
especially if you're cooking for other people, god.
Yeah. Yeah. And Brooklyn Nine-Nine just came out with some shows on Netflix, and I was so happy. Like, it just literally made my week, but I've binged
Yeah,
all of them
I
already.
I'm just really so I watched it all in the last, like, 3 days, but because it's only a 13-episode season, I
Yeah.
was like, "What kind of
Why did they
COVID
do that?
bullshit is this?"
It ended, and I was like, "What the heck?"
I
Usually they
know.
have, like, 20 plus.
Yeah,
Like, they
they
usually
well,
have a
and that's
lot.
and my wonder is, whether or not that because of COVID that they decided, "Okay, well, let's just, like, put out the real good stuff," and then because those last 2 episodes were fantastic.
Yeah, they were really good. Oh my god, it's one of my favorite shows. That is definitely a good one to get a laugh.
Oh, yeah, we could do a whole episode just talking about them, actually.
Totally. Oh my god, seriously, the best.
Yeah. Okay, so The Office, or rather Brooklyn Nine-Nine, any Mike Schur show pretty much will get somebody.
I
And
just started watching that show you were talking about on Facebook too.
sorry?
Would you rather? Would you rather? Is that the one that you were watching?
Never Have I
Nice.
Ever.
Never Have I Ever. Oh, okay, yeah. I just started that right before I came to do this, so
Oh,
it's
yeah,
awesome.
it's like I've now watched 3 episodes and I'm really enjoying it, but again, all things related to Mike Schur, Mindy Kaling from The Office, executive producers, so
So good.
yeah,
Yeah.
yeah, and it's nice that it's a show that, like, is really reflecting, diversity of culture
Yeah,
and sexuality and all of that stuff, so, yeah.
it's great. I'm so
Yeah,
excited to watch more.
me too. Alright, well, thank you for, being a guest on the show today, and, I hope your ankle is gonna be better,
I think it's okay. I haven't even noticed it talking this whole time, so it's good.
well, that's good. So,
Yeah.
again, with our 0 viewers, at least we helped you not focus on the pain in your ankle.
Yeah. Exactly.
All right, well,
Oh,
I'll
this
keep
was
you on the
good.
line, and we will wrap the broadcast up. So,
Sounds good. Thanks for having me.
thanks for being here. Bye.